I can't believe what I just read. Hey, everybody. I'm Dr. Jerry Cartznell. I'm a board certified pediatrician, and I come to you on most weeks at this time because the next 2 weeks I will not be in the office on those Wednesdays, but today I am. I come here to talk about children on the autism spectrum and problems that they have that you struggle with and trying to find answers. And today we're going to be talking about sensory integration dysfunction because the majority of our kids have that problem. And we're going to talk about that. But I want to share with you now a news release from our American Medical Association. Yes, the AMA came out yesterday with a consensus statement. And I thought you'd all be very interested to hear what they had to say. Basically, back in March, uh, there was concern about the president recommending hydroxychloroquine. And there was such a backlash to that. People were going to die taking the medication. It's not effective against the SARS virus. And people were just going to fall left and right if they took this medicine. And it had been around for decades. It's over the counter in many countries. I've used it previously in the past, but it was showing efficacy against the COVID virus in those practitioners who knew about it and were using it. And so the AMA clamped down on it and said, you cannot use this, it's off-label. Okay, and I'll talk about that in a second. And it could be actually dangerous. In fact, they instructed the American Pharmacists Association not to dispense it. Even if I wrote it, the pharmacist would say, I'm not dispensing it unless you've got an autoimmune disease, because it's also known as Plaquenil, and we can't dry up their shortage of Plaquenil for COVID. But anyway, there had been a lot of studies previously that showed that it was safe, it was effective, it's an anti-malarial, but it was really helpful in other areas, including SARS in the past. Well, they just have re-looked at everything after the elections, amazingly, and they say, resolve that our American Medical Association rescind its statement calling for physicians to stop prescribing hydroxychloroquine and chloroquine until sufficient evidence becomes available to conclusively illustrate that the harm associated with the use outweighs the benefit. They rescinded that statement. They said, resolved that our AMA reassures the patients whose physicians are prescribing hydroxychloroquine and combination therapies for early stage COVID-19 diagnosis by issuing an updated statement clarifying our support for a physician's ability to prescribe the FDA-approved medication for off-label use. If it is in his or her best clinical judgment, with specific reference to the use of hydroxychloroquine and combination therapies for the treatment of earliest stage of COVID-19. And then it goes on talking about that our AMA takes the actions necessary to require local pharmacies to fill valid prescriptions that are issued by physicians and consistent with AMA principles. So you see how much power the AMA has. He that taketh away can also give it back. So that's very good news. I'm just sorry about the people who could have had this therapeutic intervention early stages, and the disease was not to progress on further. Now, when we talk about on-label, off-label use of medications, just so you know, what we're talking about there is when it's on-label, that means the manufacturer has given clinical data to the FDA supporting its use in a particular function. Now, many of our medications have more than one function that they can do. Okay, like for example, Rogaine started out as a heart medication, but it grew hair, and they said, well, why don't we grow hair and cut the dose down, cut the price down, and then we got an over-the-counter hair tonic for guys who have balding. So a lot of medications have other applications. When I use propranolol, which is a beta blocker for lowering blood pressure for heart issues, it also is protective against migraines. And as you guys know, I use it for anxiety as well. So the medication is off-label. Propranolol is off-label use for anxiety, but on-label for its cardiac effectiveness. So just because it's off-label, that just means that the manufacturer has not produced clinical trials and spent millions, if not tens of millions or hundreds of millions of dollars to prove that they can say that, they can claim that. So that's a claim thing. Doesn't mean you can't use it. So in pediatrics, many medications that we use, almost 80% of them, if not more than 80% of them, are off-label in kids because they've never done the studies in children to prove their safety and efficacy. Maybe in 16 and older, 18 and older, but they haven't used them in children, so they can't say that it's indicated, an FDA approval for that. But we can use it off-label. And the American Academy of Pediatrics has come out with consensus statements saying that we can use that. Now the AMA also says that too. Our AMA confirms its strong support for the autonomous clinical decision-making authority of a physician, and that a physician may lawfully use an FDA-approved drug. That means it's been approved for one thing, maybe not what you want to use it for, but it's been approved for one thing, that this physician can use this FDA-approved drug or medical device for off-label indication when such use is based on sound scientific evidence. Many of the things that we do have scientific evidence saying it's effective, or, not and, or sound medical opinion. So in my case, it would be my medical opinion, and I like to think it's sound, okay? And affirms the position that when the prescription of a drug or use or device represents a safe and effective therapy, third-party payers, including Medicare, should consider the intervention as clinically appropriate, so they can't tell me it's experimental, clinically appropriate medical care, irrespective of labeling. They don't have to worry about the labeling thing, and should fulfill their obligation to their beneficiaries by covering such therapy, and be required to cover the appropriate off-label uses of drugs on their formulary. So the medication, if it's on their formulary, but I'm using it for a kid, they need to pay for it if it's off-label use. Well, what I find is that if it's an inexpensive drug that I'm using for off-label, it gets paid for. But if it's an expensive drug, even though it's on their formulary, they're going to say, that's off-label use, we don't cover off-label use. So I've got the AAP and now the AMA saying that we can use medications for off-label. And doctors, as they have been in the past, can, in their clinical judgment, if they feel that a combination of hydroxychloroquine and azithromycin and maybe an inhaled steroid are appropriate for this patient, happens to have COVID-19, they can do it. But up till now, up until yesterday, they couldn't. And they had to withhold it, or they risk losing their medical license. Now, fortunately, when I've had to use hydroxychloroquine, the pharmacy that I worked with, just happened to be, I think it was a CVS, fulfilled it. They just filled the prescription like it was nothing. So we didn't get that pushback everywhere. But I'll bet if that patient was in, say, New York, there would have been a lot of pushback. So anyway, I just wanted to let you know that apparently the data out there supports the use of hydroxychloroquine, that it's safe and effective, or they would never have come out and rescinded their own statement from March. All right, so that came out yesterday, and I just couldn't wait to share that with you because we've been talking about that. And remember, guys, vitamin D, zinc, and vitamin C, that's in your armamentarium to protect you from this. Remember also, children have a very low risk of actually contracting the disease. If they do, it's incredibly minimal, and they have not shown that children are vectors. In other words, they get exposed to the disease, they may not come down with it, but they can pass it on to grandma. So it doesn't seem that our children are vectors. They may have vectors for other things, but they're not vectors for COVID-19. All right, let's talk about sensory integration dysfunction. What is that? It's a term that basically saying, as we've talked about in the past, an inappropriate response to an everyday stimuli. And the stimuli might be a shirt sleeve on the skin, brushing teeth, washing hair, craving deep pressure, not wanting to be touched, doesn't like certain textures of foods, doesn't like certain feels. I have to see a child tomorrow, for example, who only eats hot food, won't eat cold food. Okay? They have these odd responses to stimuli that are coming to the brain through our senses. What we see, what we smell, what we taste, what we feel, what we touch, what we hear, pain. I mean, how many times have I heard the kids fall down and ripped open their knee and they don't cry? They just have an abnormal response to pain. Or just the opposite. Everything's excruciating. They're walking around with their ears. They can't smell stuff. They kind of squint. They have this weird posturing. So that's that proprio. Well, actually, that's the more sensory integration issue, and it affects everything. Okay, it affects everything. When something comes in and it's amplified too loud or too soft. So the tactile system basically talks about all the nerves under the skin, and that would probably include the tongue, okay, and the way things feel. I've had kids who, if you put their hands in, say, pinto beans, it'll elicit a vomit response because they don't like the way it feels, and it makes them want to vomit. Many of you guys have kids who have an overactive gag response. These children in this kind of dysfunction, they don't like to be touched. They withdraw. They refuse to eat certain textured foods. They refuse to wear certain clothes. My son always liked to wear shorts, and pants weren't his favorite. Still aren't his favorite, but he'll wear them, when it's cold and all. But I have kids who won't wear coats when it's 10 degrees outside. I have kids who want to wear coats when it's 90 degrees. Okay, it's just odd. They don't like to have their face washed, their hair washed. My Josh could not stand having his hair washed. And it's like, and you all have tried this too with those kids of yours that don't like their hair washed. Look, we've been doing this every day for the last year. Daddy doesn't get soap in your eyes. It's just in and out and we're done. And it's like Groundhog Day. Every time you do it again, they're screaming. They're just like, they love the bath. They're having fun until it's time to wash their hair. Abnormal response to an everyday stimuli. Brushing teeth, trimming nails. Okay, all of those sensations that come into the brain are distorted to a point where it's very obnoxious and very painful for them, and they can't organize the feelings. They can't. It's just really difficult for them. So that's tactile. Then we have something that's called the vestibular system, and that's your balance control. That has to do with the middle ear and the semicircle canals. It lets you know when you're upright or when you're tilted. It gives you that wonderful feeling when you're on a swing and you close your eyes and you kind of lose your stomach. You know that feeling? Or the people who like to spin and spin and spin. That's all proprioceptive. So, of course, now we have two groups of children who have struggles in that particular area. We have a group of children who crave it. I mean, they can swing all day. They can tire spin all day, and they don't vomit. They don't get dizzy. The kids who spin, 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 they don't get dizzy. You and I would get dizzy, and they enjoy that input. And then, of course, you have the kids who that any kind of touching, swinging, whatever emotion makes them. I mean, they do not like it. They do not like it. So you have too much or too little. I have a lot of kids. In fact, I'm working with one this week. Just hyperactive jumping. And even though now he's getting bigger, when he's jumping, he makes quite a thud, and it hurts. I mean, when you're a little kid and you jump around, it's fine. But when you're a big kid and you jump and you got 100 pounds behind you and you hit the ground, it's what they crave, but it does hurt, just like you and me. It doesn't feel good anymore to jump from a bench or whatever. So these kids can have a increased vestibular system or decreased, and again, it's an abnormal response to that input. I once worked with an ENT doctor who thought that was all viral mediated in the middle ear, thinking one of the herpes viruses, trying to figure out desperately what's going on with that middle ear with these kids. Then we have the proprioceptive. That's going to be the muscles, the joints, the tendons that provide awareness of space, awareness of where their body is. When old people lose that, what you'll see them doing when they're just sitting there, you'll see them doing this. And what they're doing is the brain loves to know where everything is. I mean, the brain knows where my feet are, if my legs are crossed. It knows how to go from this position that I'm in without me even thinking it to a standing position. If there's a loud noise or something like that. Your body knows. Now, when we don't get those signals, the body doesn't know where the fingers are. especially as old people and they get some degenerative diseases, what you'll do is you'll start to see them, they might be shaking, but they'll be doing this. And what they're doing is they're stimulating different nerves to tell the brain where the thumb and the finger are, because the brain does not like them missing in action. So you'll see that. So they don't know where they are. These children will be clumsy. They tend to fall. Their total lack of where they are in space. They may have some odd body posturing. They tend not to crawl when they're young. They tend to go from a sit to kind of a tripod scoot, okay, and then to a walk that's usually late, like 16, 18 months. They have a problem manipulating small objects. They eat in a very sloppy manner. I mean, they're putting food, everywhere they can, because again, they're having a problem with position and space, and they don't see things quite right. So this is where, theoretically we get OT involved. Now, there's been several people doing work on this, and I was thinking the next time I'll show you the most up-to-date work, but it started in the 1970s with Dr. Ayers trying to work this out. And this is from her text. You have the senses, you have your auditory, you have your vestibular, the muscle and joint, the proprioceptor that we talked about, the tactile and the visual, and they all interact with each other. And you can see between the proprioceptive, the muscles and joints, and the vestibular, what you get from those two working together: balance, muscle tone, being sure-footed, your posture, your eye movements, okay? And then obviously that's going to go further to eye-hand coordination. And just like when little guys are getting used to playing baseball, that eye-hand coordination, and finally able to hit the ball with the bat, that leads to self-confidence, self-control, self-esteem. They're accomplishing something. Nobody likes to strike out every single time they're up at bat. Nobody does. So when the kids start connecting with the T-ball, and then slow pitch, and then fast pitch, it's all coming together. That the proprioceptive, the tactile, going down a little bit further. One of the questions that I'll ask is, did the baby nurse well? So my Josh did not nurse well. The tactile issues, mother-infant bond, of course, that's going to affect. But there you go into attention span, emotional stability. So they're all interrelated. You go a little bit further, and then you get into the 80s and 90s. You'll see Dr. Lucy Miller's work, who takes the same issues and says, okay, we have a sensory processing disorder, and then there's sensory modulation, over responsiveness, under responsiveness, craving attention, craving that, like my son Josh would love to be rolled up in a little ball, and I'd give him a big hug, and ooh, that would just feel so good for him. I'm basically compressing him. And Temple Grandin's talked about that, loving the squeeze box. Some of these children absolutely need input. And then you get over the sensory-based motor disorder, and of course you have dyspraxia, postural disorders, and motor planning issues. Now, on top of all that, we interdigitate everything else that's going on in their body, because we like to break things down system by system, and we can't, because you really can't isolate these behaviors with constipation. I mean, good night. I have a child right now who's going to be hopefully scoped tomorrow. I mean, this kid's stomach looks like a pumpkin, and it's hard, and the kid is like throwing his head against concrete. He's rolling over the couches trying to help his stomach. I mean, he's in agony. Now, you go to the typical OT track, and they'll say, oh, well, he's doing that because. See, they're not thinking of pseudo-obstruction of the bowels and the pain that goes with that. He's going to think, oh, well, he's kind of, what he's doing with hitting his head against the wall, he's doing that for calming. He's trying to find out where his head is. The child that I'm talking about that I had today, he'll hit his head so hard on the concrete that it's going to cause lacerations in the skin and he'll be bleeding. That's how hard he hit. Now we're talking about 3.5-year-old, okay? We're not talking about some kind of behavior. I don't get what I want. I'm going to hit my head in the ground and mom's going to come running. We're talking about a 3.5-year-old. And so he's in agony. And even Dr. Kriegsman has a pictures of kids who do the self-injurious behaviors and their faces are all bruised, and the police are questioning the parents about child abuse, and Child Protective Services he goes and scopes him, and the kid's got severe inflammatory bowel disease. The kid was doing this in response of pain. And that's why I say that you can't just look at sensory integration dysfunction and say, oh, well, we've got apraxia, or, oh, we're doing this, we're spinning. I've had the kids who do the spinning, and spin, 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 spin. And again, the folks in OT and the sensory folks are going to say he's doing this because blah, blah, blah. The kid's got Clostridia growing in his gut. I treat him with vancomycin, or I treat him with metronidazole, and mommy, my brain's not telling me to spin anymore. So we can't isolate everything. We have to be very careful between the gluten-free, dairy-free diet. I have seen a lot of behaviors just go away or become a third of what they were just by removing the garbage food. I had another one today. The ADD improved tremendously with a gluten-free, dairy-free diet. And I have a young lady that I'm working with who, because of COVID-19, she became severely anxious, depressed, and she started cutting. And I said, oh boy, and not with autism, okay? Now, she goes and sees a psychiatrist. This is a true story. Goes sees a psychiatrist, puts her on an SSRI, like Prozac, Zoloft, ramps it up, didn't work, puts her on another one, ramps it up, and she's got some side effects from it and whatever. Comes and sees me, and I said, let's clean up the diet. Gluten-free, dairy-free, low sugar diet. The things that I'm telling you guys, okay? And she's cutting, okay? I mean, she's in agony, okay? When people cut, they're having either psychological pain or physical pain, but she's in pain. And by the way, psych drugs weren't helping when I saw her. So I said, all right, let's do this. Let's get the labs, but right now, let's just put her on this diet. And I just talked to the mom the other night. She's fine now. She's motivated. She's excited. She's everything that you'd want. I mean, she's just this bouncy, flouncy, totally resolved issues gone. I mean, and I didn't even have an opportunity to look at her labs yet because mom said she's doing well. I didn't get the labs because, dad's been gone and this. I didn't even get to do anything. I just put her on a gluten-free, dairy-free diet, got rid of all the junk food, all the sugar. I mean, sugar craving, right? Got rid of all that, and she improved dramatically, okay? So why didn't the psychiatrist think of that? They don't take a history. And the same thing with our folks doing OT and PT. They're looking at the actual raw behavior, but they're not looking for the root cause defect. Now, very often I do need them. I absolutely do need them to help me fine-tune everything, but I can get the bulk of the behaviors under control with everything else we do to make their job much easier. I really do want to make our speech pathologists and our occupational therapists and our ABA therapists look like rock stars because the child's learning gates are now open. We've modulated their silly immune response to things, and it just makes a team effort where the parents are doing the diet and the supplements, and the child's doing well with pooping, peeing, sleeping, and eating, and I got my therapy involved, and it's like a win-win situation. So we're going to get David in here, and he's going to come and hook me up with all of your questions. And I think I've got it I think I accidentally did it myself. And here we are. Oh, we got a lot here. Okay, so let's see. Carlina's on board. Hi. And Zizo is here. And your question for you is, what do you recommend kids with learning disability and no ASD? Oh, that's a good one. I was talking to a mom earlier today. I've got this. I think it worked. I just punched it. It was great because when you take away that autism component, all the other stuff that comes in, like this young lady with just anxiety, a neurotypical young lady with anxiety and depression, or a child with ADD, or here a learning disability issue, then it becomes a lot easier. Well, look, learning disabilities, they come in all different flavors. And when I just hear learning disabled, I have to start wondering why. Do we have an IQ that's being challenged? In other words, we have an 80 or 85 IQ. Do we have a child who's getting excessive amounts of sugar and food coloring or dairy? A lot of these kids who have learning disabilities, if you change their diet, they improve. Um, if you look at their diets and say they have been the the carbohydrate rich diets, rice and french fries and pancakes and bread, and they've been doing that for a long time, they're going to have a trouble learning. One of the questions I ask mom or dad if they're in my office is, if you ate what your son or your daughter eats for a month, how would you feel? Okay, and then right away they go, oh no, I couldn't focus, I couldn't con-. So very often we look at learning disability as saying, okay, have we actually figured it out? Do they have true dyslexia? Do they have a problem with vision? Do they have a problem with attention deficit? Is that why they're learning disabled? Is that they can't stay focused on something? So for that particular question, I get a kind of a history of where we're struggling. Some of these kids are like tremendous math pros, and they have trouble. They can read, but when they read Mr. McGregor chased Peter Rabbit around the garden, and then you say, "Who chased Peter Rabbit around the garden?" They can't. They can't tell you it was Mr. McGregor. Okay, but that same child, if they watched it on a 2D screen and had a picture of Mr. McGregor chasing the child around, then they know who they can answer the questions properly. So you have to also look and say, where is the dysfunction? Like, I've had kids where if you ask them or if you have them read, two different results. So you have a child who's given a test, and the test says, who was the first president of the United States? They don't know. Then you ask the child, who was the first president of the United States? George Washington. In other words, auditorily, they connect with the question, but reading it, they couldn't. Didn't mean they didn't have the answer. It was just the media that was being presented to them, they weren't able to function, interdigitate with. Okay? So there are fabulous docs out there who do what's called psychoeducational testing, and they can kind of show us where the issues are. Okay? Whether it be spatial problems or whatever. My son, at one point, if the paper was flat, he had a hard time discerning what was on it. But if it was at 45-degree angle, he could. Go figure. So I think there's some work to do with that. And that would be a fun one to work with. But I would say, let's work with the diet. Let's give him vitamins, or her vitamins, minerals, oils, omega oils, just like we do with everyone else. Okay? Nutritionally buff them up. Omega oils buff them up. Clean up their diet. And if that doesn't move mountains for the learning disability, have a really good guy, and you can get from other moms who's hot and who's not in your community. Look at the psychoeducational testing, and with that data, then we can try and figure out, do we have to help them focus? Now, I like to use natural things. Of course, I don't want the doctor just to write a prescription for Ritalin or whatever. Okay, I like to use natural things to help them get over that challenge. I hope that was helpful. Okay. Let's see. Hi, Julie. Good to see you again. Let's see. Brian. Hey, Brian. Hi, Dr. Jerry. How about Sermon? Is it helpful? Will it ever be approved in the U.S.? Okay, so Sermon is not even an FDA-approved drug in the U.S. Obviously, FDA, right? So I couldn't even use it off-label. It looks very promising, and I don't know if the company is going to take the money that's required to bring it through our FDA and the clinical 1, clinical 2, clinical 3 trials and all the stuff that they have to do to make it an FDA approved drug. And then you'd say, well, if that's the case, then why don't I just go out of the country? Well, because it's an infusion and you have to give it every 2 weeks. But to answer your question, it looks very promising. But I can't get it here, and it's an injectable, and so that's the problem. So I think it's good. I think it's got some significant promise. I hope the people who own the patents or the generics on it will bring it to market. in the US, because if it was a capsule, you can go out of the country and get it. If it's not in capsule, then how are you going to do an IV every 2 weeks? So that's the problem with that one. Maria Claude asks about zinc. What kind of zinc? I like zinc picolinate, okay, or zinc chelate. Zinc is very effective in drilling little holes in these viruses. And of course, the dosing, you want to, and again, it's age dependent, but anywhere on the little young guys, 20 milligrams, and for us older guys, 40 to 50 milligrams a day, just a day. People will tell you on the internet to take it at nighttime. Don't give it at nighttime. It hurts the tummy at nighttime. Okay, they forget about that component and all. So that's there. And let's see here. Zizo asks, running and hyper after eating. Well, of course, I'm going to ask, as you probably know, what are they eating? And you can say, oh, it doesn't matter what they eat. If they eat just protein, if they eat carbs, if they eat whatever, then it's an inappropriate response, that stomach being full, or we can have problems with digestion and it hurts, and that's why they're running. Or they can be constipated and they're having signals to go poo, but they don't want to go poo, because a lot of kids on the spectrum do not enjoy the process of going poo. And just like a young kid who's like running around holding their crotch or doing the potty dance, they don't want to take the time to go pee or poo and relieve themselves. So that's a hard one. There's not a, if they do this, then it must be that kind of a thing. That'd be too easy. Okay, I can just write them all down. If your baby does this, then it's that. It's so convoluted. So I'd be wondered what they're eating, and then I would do an elimination diet to see if they do that with every food, okay, or not. And the same approach as far as looking at everything else. How's our digestion? How's our elimination patterns? Are we drinking enough fluid? What kind of fluids are we drinking? Oh, right. Hey, Angie. Haven't heard any emergency calls from you for a while, so things must be good. Now I jinxed myself, right? Okay. Carol, my son hits his chin when he's mad or happy. How can I help him? So here you're having and this is very common, by the way, here you're having an emotional response tying into a body movement. In other words, he's hitting his chin with an emotional response when he's mad, when he's happy. And so there's something there going on. We have to go back and calm that whole sympathetic system down. This is a child, and there's probably other things going on too, that I probably want to look at the adrenaline. Is he releasing adrenaline with every emotion, every strong emotion that he feels? It's kind of common. That's what we do as human beings, but these kids can do it on a drop of a dime, okay? So like, for example, if you ever watch the game shows like I saw when I was a kid, and they'd say, Joanne Smith, come on down to The Price is Right, and they're like, ah, okay, what are they doing? Okay, their intense emotions bring out, and what they're trying to do with their excessive amount of adrenaline and excitement to come on down, and they're flapping to help bleed off that. So that it's actually a calming mechanism, even though it looks like a stimming mechanism. They're trying to calm that excessive adrenaline. So I'd imagine, without anything, that we'd probably want to consider he's responding to intense emotions with an adrenaline surge. And how I follow those, and you guys have been watching the show for a while, for those kids who can, I use the Fitbit watch, and I watch what happens to the heart rate, okay? And all of a sudden they get very happy and the heart rate goes to 150. Then I know that's adrenaline. Okay, they didn't just come off the trampoline. That was just something good happening. Or you have a denial, an access denial to something, or you have to pull away the iPad or iPhone, and then you watch that heart rate go up. And now they're in fight or flight mode, mostly fight, okay? And what they're trying to do is they're trying to stabilize that with self-injurious behavior, kind of like our cutters, right? So we'd have to take a little bit longer of a look at that, but at least you can see how much complicated these are. I almost said how much fun, but they're very complicated to deal with. All right. We got a lot of questions today. Let's see how we're doing on time. Yeah, since I'm not going to be here next Wednesday, I'll take a little extra time with you all. How's that? Okay. Harnack, and if I'm saying that wrong, I apologize. It's good to see you again. You're a regular on the show. Um, can nystatin also harm the gut lining? Generally, you don't think of it, but I've known with our kids anything is possible, and I just have to be very careful. When I've given nystatin before, and guys, that is an antifungal, and it's a non-absorbable antifungal. It actually goes in the mouth and out the anus, so it doesn't affect the liver, the kidney, the spleen. But I really think that with some of our children who may have such a problem with leaky gut, that maybe some of it does leak out of the digestive tube, because I've seen some of the darndest reactions to nystatin. Now, we used to treat babies with thrush, you know, the white stuff that builds up on their lips and their gums from nursing. We could treat them with nystatin. You can put nystatin on mom's breast if she's got some yeast growing around the nipple. And it's very, very safe, and it's been around like forever. But I've seen it cause problems, and we don't know what it's doing to the gut lining. That's a very good point. We don't know because nobody's looking. I mean, if you said, do you think it's hurting the gut lining? I'd have to have my gastroenterologist take a peek in there and see what's happened to the gut. Is it eroding or not? So we don't know. But all I can tell you is if what we're doing is hurting, we're going to stop doing it. And you said, you know, I'm giving my kid nystatin and it's making him worse. Then I'm going to say, okay. Then that's why we've got to be careful. Other people on the internet will say, oh, he's getting worse, he's screaming, he's yelling. He must be herxing. He must have a Herxheimer reaction. He's killing yeast and they're releasing their contents in his body and it's driving him nuts. Or it's hurting the gut lining, so I'd stop it, okay, and see how he does. I'd come back at half dose, and if all of a sudden the symptoms come back, you just have the wrong medication for him. He's just telling us, I don't do well with nystatin. Next. All right. Antonis, hey, good to see you. And then Harnack is back again. What do you think of the Ayurvedic medicine? That's the medicine from India. Um, there's two classes of that kind of medicine. You know what I'm talking about? One group of them has a lot of lead in it, and that's why it does a lot of good things short term. There's a lot of lead in there. I know those aren't the ones you're talking about. You're talking about the ones that have been third party tested to be lead free. Okay. I think in the hands of somebody who knows what they're doing, like homeopathic medicine, it can be a real good adjunct to what I'm trying to do. So I've worked with Chinese herbalists. Do I know anything about Chinese herbs? No. You know, these guys are good. I mean, I wish I had that kind of training. They can, I can have laboratory diagnosis of what's going on with a kid. They can put their hands on the kid and say, oh, we have a hot liver here. We have cold kidneys here. And it's like, well, yeah, the liver's enzymes are up. I can see that. And how do you know that? Just by putting his hands on the liver. So there are these guys out there, whether they be in chiropractic or craniosacral massage or homeopathy, they are gifted. And if you can find yourself a gifted healer, I'm all for it. And I work with them. So I've worked with Chinese herbalists in the past. I have a large Asian population that I take care of, and we kind of combine our talents, and I learn from them, they learn from me, and it's a beautiful thing. But the thing is, when you have somebody who's really genuine, we don't really care who makes your kid better. As long as your kid's better, they can have all the credit. I don't care. But that's the whole thing. So how I base any treatment, including what I do, is clinical response. If you say, what do you think of this treatment protocol, I'm going to ask you, is it helping? And how so? Oh, since we started, we're sleeping through the night. We don't have sandy diarrhea anymore, and he's a lot more regulated. Thumbs up. We've been doing this homeopathic medicine for a year and it hasn't done anything. Thumbs down. That easy. Okay. Let's see here. Veronica, is there a replay? Hi, Veronica. Yes, absolutely. All of these video blogs are stored on Mending Naturally, and you just have to find it. I've got stuff on anxiety and sleep and speech. mendingnaturally.com. I have the whole library there, and you can certainly download that. I'm glad you're enjoying this. I had fun with this. Okay, let's see what else we got. So, again, Antonis asks, what do you think about L-thiamine and the dose for an 8-year-old? It's not matter what I think about any of this stuff, whether it be vitamin C or zinc or whatever. It boils down to what are you trying to do with thiamine, theanine, carnitine, whatever. You see, there are certain supplements I use that work in the background that are very important, but they don't do anything. Dad's never going to call me up and saying, Dr. K, you're great. I can't believe it. When I put the kid on calcium magnesium because he's not doing any dairy or anything. I need to give him calcium. It's like, or even when I put kids on vitamin D or zinc, okay? Nobody says, oh my gosh, my kid got cured from autism with Dr. Jerry's special zinc recipe. These things work in the background. The B vitamins, except for B12, tend to work in the background. They're very important. They work in the background. And B12 I use actually as a drug, as many of you know, to stimulate speech. So I kind of, but it's B12, so I hard to get in trouble with that as far as using it as a drug to stimulate speech. So when you say, what about thiamine, what about this, I'd go back and say, well, what are we trying to accomplish with thiamine? And then it depends on what source we're using. And but again, the B vitamins are pretty safe in that we tend to, if we get high levels of the Bs, we can pee them off. But that also reminds me that the B vitamins can have hard responses in these kids too. I call them my killer bees. And there are some kids that you can't give B vitamins to, or you have to be very careful which ones you give because they don't do well with the Bs that everybody says they need. So that's a good question, but I'd like to know a little bit more about that. Let's see, I hope I don't say this wrong. Devismita asks, my son always wants some objects to be busy with. What can I help him? Okay, so that's, and I get that. I guess you're talking about like my son. He'd always carry around GI Joes. I mean, he'd always have things in his hands, and we called them his guys. And if we ever went anywhere, we'd say, Josh, get your guys. We're going to Walmart, and get his guys. And again, if you're doing everything else that we've talked about, gluten-free, dairy-free, soy-free, corn-free, he's moving his bowels well, you've taken care of bacterial infections in the gut, taking care of yeast in the gut, and he's still got this predisposition to holding his stuff. And sometimes it's colors or threes of everything or whatever, but his hands are full or one hand is full. He's always got something. Then what I do is what we would try to do with Josh is that he can have his guys in the car, but while we're at Walmart, we leave the guys in the car. Okay, that was a little hard transition, but we got it. We go to a restaurant. Now, this was back in the days when you could go to restaurants and you didn't have to wear a mask. We have the guys in the car. Then it was, you can have your guys, but they don't go in the car. They stay at home. Okay, so then he would have his guys at home, and then as soon as we went somewhere, and he kind of just got used to that. And then you can have your guys, but let's just keep them in your room. Okay. So, but kids, these kids, they use them as transition issues, just like a little baby with a blanket, and they bring a lot of comfort. But I'm going to look and see if there's other things that we can do to help them so they don't feel like they need their stuff. Some kids outgrow it, some kids don't. Okay, just depends on the level of damage in the brain. All right. Fariha, and I apologize if I mispronounced that. She asks, what do you help with hyperactive, especially when demand is put on the child? Okay, hyperactivity. I mean, that's a whole talk in itself, and I've talked about ADD and ADD with H in prior video blogs. But again, I'm going to assume that we are on a gluten-free, dairy-free, soy-free, corn-free diet. We're moving our bowels every day. We're sleeping from, depending on the child's age, 8 to 6. We're not up in the middle of the night. Okay, we've got to get all those things going. And we're eating a good balanced diet, or we're being supplemented with vitamins, minerals, and oils. You cannot get anything until you've got that. That's like your foundation. You got to build that foundation before you put something on there, okay? And then you start saying, okay, what have I got? I love magnesium to calm these kids' brains down. Magnesium bisglycinate, magnesium L-threonate, magnesium chloride. That's the liquid one that I really like, okay, because it gets absorbed easily. I like L-theanine. I think L-theanine can be very calming for these kids. If it's an obsessive compulsive kind of a thing, I'm going to go ahead and put them on 5-hydroxytryptophan. Now, if your kid is becoming very angry um, when you're asking a demand put on him, then I'm going to go down to the other side of the road where I'm saying, is he seeing the demand placed on him as a crisis? And he is adrenalizing and he's getting into fight or flight, and he is flighting from you. So then we'd be thinking about beta blockers. So there's a lot of options that we can do there, but I think the basics is where you got to go. Let's build that foundation first, and then let me know. All right. I don't know if I'm going to get through all of these today. Okay, so Maha. Hi, Maha. I'm glad you joined us. You said, my son has been gluten-free, dairy-free, low-sugar diet for more than 2 years. All his food is organic. He only eats homemade food. He takes minerals, electrolytes, fish oil. But he's severely constipated for over a year. His GI recommended daily dose of Miralax. But I don't want to put him on a medication. What do you recommend for that? All right. That's the one nice thing about being an MD, is that I can use my natural stuff. And if that doesn't work, I can get into my MD stuff. So what I tend to do is I tend to put them on something quickly to decompress their bowels. Okay? And Miralax is colorless, odorless, and tasteless. And you can get it anywhere. So I can start on that. Okay? Now if I have a child who's swallowing pills, then maybe there's some other options. Okay? In my office I have a product that I've formulated. It's called Colon Mend. It's a natural product. But I also like to use lots of other products. I like Natural Calm. I'll use suppositories or enemas to get the cork out. Remember, the colon is not an elastic organ. If it's big, full of a lot of poo, no matter what I do, if I clear out that poo, it's still big and it wants to be filled up again. Now, I want it to be about the size of a toilet paper tube, right? Now, the only way I can go from here to here, it takes about 8 to 12 months for that to contract. It's kind of like after a woman gives birth to a child, the next day, she generally doesn't look like an 18-year-old again. It takes a while for things to go down. Now, the lungs are different. They're elastic. That's wonderful. But the colon's not like that. Now, the colon sends signals to your brain it's time to poop, just like your bladder does. When your bladder wall stretches, it sends a signal, time to go tinkle. When the colon wall stretches, it sends a different type of signal, time to poo. If it's already stretched out and it's already that big, it's not going to send any signals to go poo for a long time, because we have to wait for it to go down to a normal size. So he's going to be on something for a long time. I like magnesium citrate. I like milk of magnesia. I'll use Miralax for my kids who are really taste sensitive. I'll use some herbals, like I said, my Colon Mend. I love my fiber called Mending Naturally Fiber. Okay, so they need a lot of fiber. But this is a year process, and what I very often do is, and you may not like this, but I start them on Miralax to get things going because I know it'll work. And then I'll bring in my natural stuff and see if I can get that to work just as well. And then I take it off. But I get them out of that constipation. That's painful too, by the way. If you've ever been plugged up, it's not a comfortable feeling. You're not going to get your best performance when you are backed up. Okay. Good question. Let's see. Okay, reply. Claire says her son does this. Yeah, that's a very you know, we probably ought to go through constipation again. I've got some beautiful video blogs on constipation, but I can always do a new one too. Let's see here. Megan, she wants to know how to keep a 14-year-old sleeping through the night. Well, now my question is, have we always had problems sleeping? Have we tried melatonin? Have we tried clonidine? There's a lot of interesting things we can do to help our kids sleep through the night. I like slow release melatonin. with melatonin. And then you might be writing out, we tried melatonin, didn't work, or woke her up. That's my problem with this kind of a conversation, is that things that I might mention you already did. Now, if she's had problems sleeping since birth, then we may have something going on in the brain. Okay. No, doc, this seems that after puberty changes and it's really bad around her cycles, then we know it's more hormonal. I might have to give her a little bit of progesterone. No, doc, she's 14. We really never tried the diet with her, and she does like a lot of sugar, and well, sugar is energizing. I mean, ask a teacher, what class would she like to teach? The class that hasn't had sugar, or the class that's had Halloween sugar? I can tell you where we're going with that. So the other thing too is, do we spend a lot of time on the 2D screen? If these kids are on Facebook or iPhone a lot, these things stop our body's ability to make melatonin, and we're not going to go to sleep. If we're watching TV or whatever. So we also want to have 2 hours of that. Some of the kids, they wake up in the middle of the night because they're obsessed with something, or they have anxiety over something, or their bowels hurt. So again, that's a great problem, but there are a lot of treatments that are available, a lot of things you may not have thought about that we can actually take care of. My dog is telling me it's time to go. Not yet. Be patient. All right, let's see if I can get one more in there. I think that was it. Now, if you asked a question, it's not up here, or I missed it, email us and I'll answer it next time. So I'm going to take the next 2 weeks off, guys, and I'll see you back. And if I get a lot of questions about this, we can go into the autonomic nervous system, the somatic nervous system. We can do a lot more on this if you'd like. I didn't know quite how involved you wanted to get, but it's been a pleasure being with you today. Thank you so very much for watching. Tell your friends about us too, because I love these interactions. In fact, I'd love to build it to an hour and we just do questions and answers. Okay, that'd be kind of fun, and maybe even a phone-in kind of thing. So anyway, have a great holiday season. If you celebrate Christmas, have a wonderful Merry Christmas. If you celebrate Hanukkah, that too, and any of the holidays that you are enjoying with the kids, don't spoil them with sugar, okay, because you're not going to have a good time with your holiday. But have a very safe and blessed holiday time, and a healthy and happy new year. And I'll see you guys back in 3 weeks. I can't wait. Take care now. Bye-bye.